Hello, we are Group 3 and we were assigned to pick a specific topic in healthcare. We will be discussing and demonstrating medication errors and how they can be performed without error. I'm Jordan Kuhn and I will be demonstrating wrong dose and how it can be corrected.
Hi, I'm Bryant and I will be demonstrating wrong patient and how it could be corrected.
Hi, I'm Bowman and I'll be demonstrating wrong medication and how it can be prevented.
Hi, I'm Burgan and I'll be demonstrating wrong route and how to prevent this from happening.
Our topic is medication errors. We picked this topic because it's an importance in everyday healthcare. Shervaka in a 2018 study said medical errors affect 1 in 10 patients worldwide. One extrapolation suggests that 180,000 people die each year, partially as a result of the iatrogenic injury.
Wow, 1 in 10 patients worldwide are affected by medication errors? Did you know that medication errors are a huge issue in healthcare today?
Yeah, nurses' issues affect patients physically, mentally, and emotionally.
Wow, this sounds like there's other factors that play into this.
Yeah, so nurses have factors that contribute to medication errors, like overwork, exhaustion, nurse burnout, lateral violence, and nurse-patient ratios.
Oh, so nurses can experience effects from other nursing issues that can lead to medication errors?
Yeah, so they result in medication errors. Nursing issues are a huge problem because they affect the aspect of the healthcare system. This affects the cause of workplace tension, financial burdens to the hospital, and patient care and patient's health. Here's 10 rights of medication administration. The 10 rights of medication are right patient, right medicine, right dose, right route, right time, right documentation, right education, right to refuse, right assessment, and right evaluation.
Hello, my name's Jordan and I'm going to be your nurse today. Can you tell me your name and date of birth?
Yeah, Austin Wade, March 2nd, 1998.
Awesome, and how much do you weigh?
165.
Perfect, okay. And I see the doctor has ordered 2 milligrams per kilogram an hour IV infusion of morphine. So I'm just going to calculate your rate and your how much morphine to give. All right, once I multiplied your weight by 2 milligrams, I came out to 330 milligrams of morphine. So, unfortunately, if that were to happen in real life, I would have caused the patient to overdose and we would have to administer Narcan. Instead of calculating kilograms per milligram, I calculated pounds per milligram. So, I would need to take 165 divided by 2.2, and then multiply it by 2.
Medication errors such as wrong dose is very common among pediatric settings. Many medications are made for adults and they are in adult doses, so you have to calculate doses for pediatric patients, and this is oftentimes done by calculating doses by their weight. In emergency settings, oftentimes nurses have to just look at the patient and estimate how much they weigh, and that can often lead to medication errors. When you have to calculate a dose simply by weight, it puts patients at higher risk for medication errors, and that's what Hughes and Edgerton had discovered in 2005. There's multiple ways that we can fix or kind of prevent medication errors, especially when it has to do with the wrong dose. We need to, first of all, always identify our patient. In the skit, I had only verbally asked for identification. I did not check the armband. I did not double check orders. I simply wrote down the orders and calculated the dose, and I should have went back in the MAR to double check that those orders were correct. I did it in the patient's room, and that is a huge distraction because you want to administer the medication and not keep them waiting. So I should have left the room and calculated the medication amount outside of the room. And another way I could have prevented medication error was to have another nurse double check my calculations. Yes.
Hi, Mr. Fisher. I'm your nurse today. Can I help you?
I'm having a lot of pain in my leg.
Can you rate that pain for me?
It's a level 10.
Okay.
10 of 10.
Okay, I'm going to go talk to your doctor and see if we can get something to help with your pain, okay?
Okay.
All right, I need to give Dr. Tonsberg a call.
Hello, Dr. Tonsberg.
Hi, Dr. Tonsberg. This is Nurse Hannah. I'm calling about my patient in room 274. He has chronic pain. He is stating that his pain level is a 10 out of 10 and was wondering if he could get any pain medication.
Yes, I want you to put in an order for 30 milligrams morphine sulfate POQ, 12 hours for 7 days.
All right, thank you. Bye. Hi, Mr. Fisher. I'm back with your pain medicine, okay? So your doctor ordered morphine sulfate IV push, okay? Is that all right with you?
Is it gonna hurt?
It's not. You might taste a little something in your mouth, a little salty, but it won't hurt. It'll take the pain away.
Okay.
All right, let me see your IV. So instead of doing this over 5 minutes, I'm just going to go ahead and do it since you're in a lot of pain. Hi, Mr. Fisher. I'm here to check on you to make sure that your pain has gone away. Mr. Fisher? Mr. Fisher? Oh no, he's not breathing. I need to get the Narcan. Let me call Dr. Tonsberg.
Hello, Dr. Tonsberg speaking.
Hi, Dr. Tonsberg. This is Nurse Hannah. I'm calling about my patient in room 274. He is saying that he is having severe pain. This is a chronic pain, but he's saying that it is 10 out of 10. Can you give me some orders?
Yes, I want you to put in an order for 30 milligrams morphine sulfate POQ, 12 hours for 7 days.
Okay, so let me read that back to you just to be sure. You said morphine sulfate, 30 milligrams, IV push for...
Sorry, I said PO.
Oh, PO. Oh my goodness, can you imagine what would have happened if I did the wrong route? Wow, let me make sure that I really have this. You said morphine sulfate, 30 milligrams, PO, for 7 days every 12 hours.
Yes, that's
okay.
Correct.
Thank you. Hi, Mr. Fisher. I just got off the phone with Dr. Tonsberg, and she went ahead and ordered morphine sulfate, 30 milligrams, and this is going to be by mouth. So it's going to last all throughout the day for about 12 hours, and hopefully we can get your pain level to subside. Is that okay with you? Okay, let me just double check here. Morphine sulfate, 30 milligrams. Okay, can you tell me your name and date of birth?
Jonathan Fisher, July 4th, 1990.
July 4th, 1990. Okay, thank you. Here's your cup of water. And here you go. Can I see it on your tongue, please? Okay.
What are you actually giving me?
Swallow it. I'm giving you your morphine like we just talked about.
The patient is coming to the emergency department after recently starting vasotech to treat hypertension, and his face and throat are beginning to itch and swell. Hey, I'm Molly. I'm going to be your nurse today. Can I see your arm? What's your name and date of birth?
It's Thomas Carter, December 7, 1997.
Okay. What's bringing you into the hospital today?
I started taking medicine for high blood pressure about a week ago, and now I feel weird, and my face and throat are really itchy.
Okay, what medicine is it?
I don't remember.
Okay, I can check your records and ask the doctor if you can get a prescription for something to help with the itching. Hey, I'm back. I checked with on the computer, and you're on vasotech. Does that sound right?
Yeah.
Okay. Here is your medicine to help you with some itching. Here's your water.
Okay.
I get you. Here you go.
What is this?
It is benzapril, which is another name for Benadryl. Can I check your name tag really quick?
Yeah.
Can I have you say your name and date of birth?
It's Thomas Carter, December 7, 1997.
Okay, thanks. I'll take your medicine. Can I get you anything before I leave?
No.
Okay. You want me to take your cup out? Are you okay? Get some help and hit the call light. So if this were to happen in real life, the patient would have was experiencing a side effect from the ACE inhibitor vasotech, which causes itching and swelling of the face and throat. And giving the patient benzapril versus Benadryl would make that symptom worse, and he could have ended up having a tracheotomy to maintain a patent airway for him to breathe if it had completely closed. Brianna Silva, a doctor at J Community Hospital, says medication reconciliation, including an indication review for each prescription, is an important aspect of patient safety. The decreasing frequency of pill bottle reviews, suboptimal patient education, and poor communication between healthcare providers are factors that threaten patient safety. The patient needing a tracheotomy could have been avoided if the nurse had taken time to recheck and check the medication to make sure it was the correct medicine, being Benadryl, not Benzapril. Some medication names sound very similar, and they're easily confused and mixed up, and they can cause life-threatening side effects for the patient.
I really need to go give the medicine in room 6. Gosh, I've just had a really bad day. Hi, I'm Katland, and I'm going to be your nurse today. I'm going to give you some medicine, and it's called acetaminophen, and it's 500 milligrams. Do you have any questions? Okay, well, I'm going to go get the medicine for you. I don't have time for this. I'm exhausted from being overworked, and I have no staff to help me. Okay, here you go. Okay, take that. Alright, do you have any questions before I leave the room? Okay, great. Oh, thank God that's over. That's interesting. I already have a call light from room 6. What could they be needing? I just gave them meds. Hello, this is Nurse Caitlin. How can I help you today?
Can I have my pain meds? I thought I could have them a while ago and I'm really hurting.
Oh no, I just gave them to the wrong patient in room 9 that speaks another language. No wonder they couldn't talk to me. Why didn't I think to check their name on their ID band or get an interpreter? Oh, this has just been the worst day ever. In this scenario, the nurse should have verified the patient by checking their ID band and asking them their name and date of birth. Then the nurse should have recognized that the patient isn't understanding what is being asked of them and speaks a different language. So she should have gone and gotten an interpreter before beginning any nursing skills. Next, the nurse should always be respectful to the patient's cultures and beliefs. And if she has any questions about that culture or belief, to be familiar with it and to do personal research on the side to know how to fit that patient's best needs. The nurse also should have slowed down and thought about what she was doing, even if she was busy with her heavy patient load. Now, because of all of these mistakes the nurse has made, the patient is at risk for many adverse effects. The nurse is now responsible for consequences for not identifying the patient before giving the medication. Now, the hospital may be affected from financial expenses related to giving this patient the wrong medication. Some of the ways that this would be costly to the hospital would be they'd have to pay, for treatment for the adverse effects, longer hospital stays, and they may need added medicine to fix these adverse effects, and many other things. By doing this, the nurse was not advocating for her patient whatsoever. According to the National Journal of Nursing, the results showed that the most common cause of medication errors in nursing were tiredness due to increased workload, and this was 97.8%. The nurse expressed how she was tired from being overworked, which led her to be careless with her patient's medication. The nurse gave the wrong patient the wrong medication, which affected both patients in the end. The patient that the medication was intended for is now in pain from having delayed medication, and the patient that received the wrong medication was given pain medication for no reason. This problem could have been avoided if the nurse was not exhausted from being overworked by a heavy patient load and paid more attention to the work that she was doing.
This topic is a serious issue that can be presented in many different ways. Nurses in workplaces must work together to decrease the amount of medication errors to ensure that patients can trust our healthcare system. The patient deserves to receive the best care possible in order to trust the healthcare workers that are helping them. Medication errors can be deadly to patients and is a very serious issue in our healthcare system today. There are many issues in healthcare that need to be addressed, but hospitals need to recognize and fix this issue. One solution to this issue could be monitoring nurses that are overworked and let them feel like they can express their emotions or needs to an appropriate staff member.
Oh wow, that's interesting. Well, when you're in the nursing care setting, you also have to remember cultural issues and be very culturally sensitive. A lot of medications, pills specifically, are made from capsules from gelatin, and gelatin's made from pork and beef product. And this is an issue amongst Muslim patients or Jewish patients who cannot eat pork products.
Oh wow, that could be a problem.
Yeah, so it's super important that you assess any cultural beliefs that your patients may have. Medication errors can cause workplace tension, financial burdens to the hospitals, can affect patient care like we've said, and patients' health. These errors are easily fixed, and the solutions that we've offered through this video are some of the many ways that it can be prevented.
That's true.